The pandemic has taken a dramatic turn in South Africa barely a week after the country's scientists flagged the discovery of a new COVID variant, Omicron. The country is now seeing a sharp increase in infections due to the newly discovered variant. Scientists say that the symptoms appear to be mild, but Omicron is fast overtaking Delta to become the dominant strain in the country. I will be talking to one of the experts studying the new variant after this update from DW's Adrian Krish in Johannesburg.
We are currently here in Soweto, a township in Johannesburg, and authorities are going from door to door trying to convince people to get the jab. Up until now, only 25% of South Africans are fully vaccinated.
They say that when you get vaccinated, you get some diseases like COVID-19.
Maybe they're afraid because some of the people, when they do vaccination, they get sick.
There's fear that just came around, people thinking that when you vaccinate, maybe you are going to get sick or something. I think the problem is there. But I can assure people that there's nothing like that. Because I have vaccinated a long time ago, but I'm still okay.
You can see the rapid rise at which the cases are rising. We have this new variant, Omicron, that is ravaging across the province. The good thing, the indications from our scientists is that those who are vaccinated have only mild symptoms.
The premier of the province, Gauteng, the epicenter of current infections in South Africa, says that he is optimistic that the fourth wave will not be as bad as the previous ones, counting on vaccinations. And despite the slow uptake, he says the previous few days have shown that more and more people are now ready to go and vaccinate.
My first guest today is one of Africa's top epidemiologists, Professor Salim Abdul Karim. He led the South African government's advisory committee on COVID-19 until earlier this year. Welcome back to DW News Africa, Professor. What did you think when you first heard about this new variant that has now been named Omicron?
Well, when I first received the information that there was a new sequence that had substantial number of mutations, I went down to have a quick look at it. This was just over a week ago. And what struck me was the large number of mutations. It's really a very different looking virus. And what was striking to me was that it has characteristics and mutations from all of the 4 other variants of concern. So when I looked at it, it meant that it could transmit faster because it's got the mutations from Delta variant that enables it to move, to spread faster. And so that's what concerned me when I first saw it.
And concern, Professor, that you're talking about is the reason that a number of countries panicked at the news of this variant. You and others have been very critical of the travel bans that have been imposed on South Africa and neighbouring countries. If not the travel bans, what would have been the better response?
I think when the globe is facing a threat like this particular new variant, I think what becomes important is to stand together and to try and find solutions. And when we think about a variant like this, by the time we described it, I have to go on the basis that this variant has been spreading for several weeks, because you have to get to a critical number of infections before we can pick it up in our surveillance system. And when we do, we have to then verify it. And so all of that time means that by the time we show it's present here in South Africa, it's probably in most countries around the world, because that's how this virus spreads. So travel bans don't really help.
Understood. Professor, will we ever know where Omicron originated? And is it important to know where a variant originates?
I think it's quite important to have some idea of where a new variant emerges, just as much as it's important to know where the original virus comes from. And what we can say, because there are now several studies, that it has probably come from an immuno-compromised individual. And that, immuno-compromised individuals are people who have cancer or advanced HIV or transplant recipients. And we have these kinds of individuals all over the world. So it could be literally generated anywhere in the world. And we have seen that. Alpha variant was first described in the UK, Delta in India. So it doesn't mean that because we reported it in South Africa that that's where it originated.
Yeah, Professor, you introduced the aspect about immuno-compromised individuals. Could you tell us a little bit more about the link between COVID variants and HIV specifically?
So what you have is, in an immunocompromised individual that is not able to mount a response against the virus, what you have is a situation where normally a person who gets infected clears the virus within 2 weeks or so. But in an individual who is immunocompromised, they maintain persistent infection for months and months and months. We have ourselves described patients that have had the infection now for 7, 8 months. And during that long period, that's when the mutations occur. That's when the mutations accumulate in the same virus. And that's what the problem comes about. And HIV individuals are a small group within the overall larger group of immunocompromised individuals. And HIV individuals can be among those where this virus can lead to these mutations. It's not the only group, but it's one of the important groups.
Understood. I mean, Omicron has dealt us a real blow, Professor, and even as we don't yet know the full picture of it, how much more of this will there be? Should we be expecting more variants? And will these ultimately prolong this pandemic?
Well, Christine, I think the whole world is frustrated, angry, and frankly fed up with this virus. We want it to be gone. We are done with this virus. I think, unfortunately, the virus is not done with us. I think that the reality is going to be that we are going to see several more variants. Now, there will come a point where the virus simply cannot mutate anymore and get advantage. But that point hasn't yet been reached and probably will not be reached for another year or so or two. We don't know. But we can expect that we will be seeing more variants. Omicron's, the fifth in the line, in the sequence. We have to expect that there'll be a sixth and a seventh, and we don't know whether there'll be any more after that.
And vaccination, how crucial does that then become?
So when we look at the current evidence, we find that vaccinations reduce the risk of severe disease and hospitalization across all the variants. So it doesn't matter what variant you have, almost all the vaccines do very well in preventing severe disease and hospitalization. So there's no reason to think that that will differ now, because hospitalization, severe disease is mediated through T cells more than antibodies or anything else in our immune system. And those tend to protect us regardless of the changes in the virus. So get vaccinated. This Omicron variant is a wake-up call, because those individuals who are not vaccinated are going to be the ones who are going to need hospitalization and severe disease. Get vaccinated to protect yourself.
All right. That is, of course, Professor Salim Abdul Karim talking to us there from South Africa, where some world-class scientists have brought us news of this new variant. Thank you so much, Professor, for the work you and your colleagues in that community are doing.